Hi guys, Dr. Mandi here from Chiropractic, and today I'm going to talk about something you might not know that we can actually help with, which are tethered oral tissues, aka tongue and lip ties. So we see this frequently in babies, and not a lot of people think that coming in here can help, but there's a lot of things we can do for it. So a couple of signs and symptoms to look out for with babies that do have some ties are going to be pain with mom with her nipples. Baby, if you would notice like a clicking or popping, kind of like a when they're latched onto the breast. If they take a very, very long time to nurse, and I'm talking, 20 minutes is normal. If we're like 45 minutes, an hour, takes that long, and sometimes they fall asleep halfway through. Sometimes that means they're overworking and they're too tired to kind of finish that. Or if you notice reflux, spitting up after every time they eat, issues with gas, like they're really, really fussy and then they kind of fart and then they're okay. So those can be signs that they're sucking in too much air and their latch isn't perfect. If you also notice they don't have a very good gag reflex, like whether you stick your nipple in their mouth or a pacifier or your finger and you don't even get very far back and they immediately like, ugh, that can also be a sign. A couple other signs that you can notice are if the baby is fussy. Now, of course, fussy babies, there can be lots of reasons why, but if they're not getting enough milk, or if, again, they're getting so many bubbles in their stomach that they can't kind of process that, they can make them very uncomfortable. Now, back to mom, clogged ducts can be a symptom. The like lipstick nipples can be a symptom. Not feeling like you fully empty your breast can be a symptom, again, because they're not effectively latching on and getting that milk out efficiently for you. Then a couple other symptoms, again, with baby, if you notice a lot of like gulping whenever they're eating, again, if they're fussy, if they're mouth breathers too, like when you notice when they're sleeping, most of the time they should have their mouth closed. But if you notice they're like snoring or sleeping with their mouth open, that can be another sign that's sometimes often missed actually. Now, what can we do here? So not only will we assess their mouth, so I put on gloves and I'll kind of feel all around in their mouth. I'll feel the roof of their mouth. We'll feel like in their jaw, because most of the time if they can't functionally latch with their tongue, they're going to chomp, which is where the pain for mom comes, and they're going to be over tight in their jaw. And then that jaw tightness can lead to neck tightness, and then that can kind of trickle down their whole body. So not only will we look at their jaw function and their latching function, but we look at every muscle in the body to make sure it's not also affected there. Now, what we can do depends on what's going on with baby. We can give you exercises and stretches. We can show you how to like shape the roof of their mouth, because sometimes, again, with the tongue, when it's latched on, that's what helps shapes the roof of the mouth. And it should be a perfect rainbow. Sometimes it's kind of like a flatter at the top. Sometimes one side's a little lower than the other. And this can all affect them being able to get that nipple deeper in the mouth. So we can work on exercises that you can do and we can do here to help shape that a little bit nicer. We can go over stretches for their jaw, both inside the mouth and externally. Now, babies don't typically like this. They don't like their mouths played with, but it's okay. It will help them. And then we can go over how to actually loosen up the tissues around both the lip tie and the tongue tie. So rarely will you have a lip tie without a tongue tie with it. Sometimes you, though, can have a tongue tie without the lip tie. But we want to kind of check and see if it blanches when we look at it, or if it just feels very, very tight, or if it's very thick. Those can all be signs of tongue and lip ties. Now, again, I send you home and I go over everything as far as exercises, stretches, and I want you to do them frequently at home. It doesn't take more than like 5 minutes to do, but you want to do them, 3 or 4 or 5 times a day, because with babies, they're so young and they're so moldable at this age. More frequent is better than like long periods of time, and you can help with that. And then again, we go over full body assessment. We'll check their neck motion, their pelvic motion, all the muscles surrounding that. Now, sometimes you can do all this work and they still have issues. Thankfully, here in town, we have some great providers here. We have a dentist who's fantastic, and we have 2 pediatricians who also do releases. So we can go over if you're doing all these things and your baby's not improving, sometimes they need those extra revisions to get that done. But hopefully, even if you need to get them done, all the work before actually helps their outcome after. If you have any questions about tethered oral tissues, aka tongue or lip ties, give us a call here.